welcome. So thank you all for being here tonight. And the reason why I put this workshop together is because I have had several conversations with many of my patients, and they all are saying, every holiday season, I tend to get sick. So I'm like, well, would you like to learn how to not get sick during this holiday season? And they're like, yeah. So I'm like, all right, well, let me put together a workshop, hence super immunity. So do we really have a cold and flu season? Or do we have a sugar holiday followed by a sugar holiday followed by a sugar holiday followed by a drunken holiday, right? And a lack of sunlight and vitamin D. So is it really a cold and flu season, or is it just that things tend to shift? And as long as you're aware of these things, then you can do things that would then help to keep your immune system nice and strong. So tonight, we're going to be talking specifically about the immune system. We're going to deepen your understanding of this. Because if you want to play a game, you need to understand the rules. Like if you're going to play basketball, you got to understand what the rules are. You got to dribble, you got to pass the ball, right? You only get 5 fouls, there's boundaries, right? So you have to understand the rules if you want to play. So how much do you guys really know about the immune system? Not too much. That's why I'm here. Then also, what negatively influences the immune system, what positively influences it, and then what can you do to actually strengthen your immune system at home? So let's get into this. So the age-old question, the $62 million question. Do germs cause disease?
Question.
How many people say yes? Raise your hand. How many people say no? How many don't know? Okay.
Can I comment?
Yeah.
I think germs cause things, but I think you have to be in a weakened state or you have to somehow be receptive to that.
Yes, you are correct. You want to come up and teach class? You're absolutely right.
Okay.
So if they don't cause disease, then what does? Exactly what you said, a weakened host, a dysfunctional body, and lowered resistance, which we're going to dive into this, okay? So let's go back in time a little bit. Giants of the 19th century, right? Louis Pasteur and Claude Bernard. They did this research into their work. Louis Pasteur was a chemist and a microbiologist. He was renowned for his discovery of principles of vaccination, microbial fermentation, and pasteurization. He came up with the germ theory, which are the diseases are caused by infectious microbes. Claude Bernard was his contemporary, and he was a physiologist. And he said that the importance of balance in the body's internal environment is what's most important. And Bernard thought that the body becomes susceptible to infection agents only if the internal balance, or homeostasis as we now call it, is disturbed. So which one is right? Well, Louis Pasteur renounced his germ theory on his deathbed, saying that Bernard is right. The microbe is nothing and the environment is everything. Rudolf Virchow, the father of pathology, he stated that if I could live my life over again, I would devote it to proving that germs seek their natural habitat, diseased tissue, rather than being the cause of the diseased tissue. Like mosquitoes seek the stagnation of water, but they do not cause the pool to become stagnant. So it's kind of interesting. And a nice example of this is, well, what happened during COVID 5 years ago? Right? Why did COVID spread like a wildfire? Because it's a virus, right? Well, how healthy is the American population? Right? 60% of the American population has one chronic degenerative disease. 40% have 2 or more. So if you have a population that's already sick, and you leash a new virus on them, it's going to spread like wildfire. But do you remember what also Anthony Fauci said? 85% of people may not experience symptoms at all, right? You can be infected, but you don't have to experience symptoms. And that is true for anything. People that work in an office environment, right? Oh, I'm catching whatever's going around, like, is that really true? Or is it that you think that you're going to catch something and your mind has part of that ability that you are fulfilling your own prophecy? Okay? So it's kind of like allergies. Like, how many people have seasonal allergies? And if we had a office room of like 100 people and we had 2 big fans there and we threw up a bunch of bags of pollen that sprayed the whole room, how many people are going to be affected by that and how many people aren't? So obviously you'll have varying degrees, right? So it's not that the pollen is in the environment, it's what's going on inside you that will create the allergic reaction or the immune system to get infected or not. Dr. Rene was a renowned 20th century microbiologist, and he said that most microbial diseases are caused by organisms present in the body of a normal individual. They become the cause of the disease when a disturbance arises which upsets the equilibrium of the body. So you can see that everything's kind of going towards the terrain, the internal environment. And a picture is worth 1,000 words. So here's the 2 different theories, right? You have the germ theory, where you've got a fish that's in a dirty environment. So what do most people think is positive, right? Is let's vaccinate the fish. Well, the terrain theory is let's clean the tank. So 2 opposing theories, okay? Not necessarily that one's better than the other, but it's like, what do you believe as an individual? Because if you believe something is going to work, then you should stick with that. You want to treat the patient and not the infection. Come on. Oh, baby. All right. So we all know about the microbiome, but has anybody ever heard of the word virome? All right, you're dead. All right, so we have 35 to 40 trillion cells in the body. 38 trillion bacteria that live in and on our body. It's called the human microbiome. You have 380 trillion viruses that are inhabiting us, named the human virome. And then on Earth, we've got 10 to the 30 degree of viruses that actually live here on Earth. So is it really about avoiding germs? Everywhere. Yeah. Can you avoid them? No, you can't, because they're everywhere. So what is the purpose of the immune system? Well, there's several different purposes, right? Number 1 is to protect against microbes, toxins, and chemicals, right? Things that we ingest in our food, right? Chemicals and poisons and things, right? It's there to help clean that up. To clean up damaged tissue and repair daily wear and tear. So if you sprain your ankle, you injure your shoulder, you got damaged tissue there, the white blood cells kind of come in and they kind of clean house and they restore normal. Okay? And then to recognize self and non-self substances. So this is where autoimmunity comes into play. So when the immune system can no longer recognize self versus non-self, this is where people then develop autoimmune diseases. So inflammation. Inflammation equals your immune system. Okay? Have you guys ever heard of the cytokine storm before? No? You have? Where did you hear that?
Probably in my microbiology classes in college.
Okay. And you heard it a lot too with COVID as well. Because what happened, right? People got infected with COVID. They have this cytokine storm going on in their lungs filled with fluid. They got to go on respirators, and a lot of those people ended up dying, right? So the cytokine storm is just a reaction or the immune cells that release all these chemical messengers that go around and tell other immune cells to come and we got a war that we got to wage here. So inflammation and the immune system are the same thing, and the cytokine storm is part of that. All right, so what's the purpose of inflammation? To eliminate the cause of injury. Inflammation helps to isolate and remove the source of damage, such as pathogens, bacteria, viruses, toxins, or physical trauma. Repair damaged tissue, right? To recruitment of the immune cells. And then also to promote blood flow, right? If you sprained your ankle and you tore some ligaments down there, you got to increase the blood flow in the area to flush that out. But at the same time, you got to have the white blood cells that kind of come in and munch on everything and eat everything up so that it can then heal. Because you don't want the damaged tissue just to still be there, because then it becomes necrotic and you can have an infection going on in there, and that's when things really turn worse. All right, so signs of inflammation, right? Fever, abnormal motion, redness, swelling, and pain are all signs of inflammation. And as you can see, one hand is red, swollen, and hot. Well, you don't know if it's hot or not, but you can imagine that it's hot as a result of that. So FARS-P, okay? FARS-P, those are signs of inflammation. Pointed out for a reason. We'll come back to that later. How many of you know what the lymphatic system is? Okay, some of you do. So the lymphatic system is basically the sewer system of the body. Now, it has to collect all of the debris and the toxins from the blood and the extracellular fluid that it then has to dump back into the blood for the liver, the spleen, and the kidneys to filter out. And if the liver, spleen, and kidneys can't do that, then your lymphatic system can become full and congested. So imagine, how long would you be able to live in your house if you had 18 inches of sewage on the first floor of your house, right? Not a pretty picture, right? So when you get lymphatic congestion, it is really, really bad in the body. And you can see that it's everywhere. It interweaves between all of the blood vessels and stuff. I got some other pictures to show you that. But the purpose of the lymphatic system is that it's part of the immune system. It keeps body fluid levels in balance and defends against the body against infections. Lymphatic vessels, tissues, organs, and glands work together to drain watery fluid called lymph throughout the body. So other pictures of this, right? You can see you got these little green circles, which are your lymph nodes. Now, your lymph nodes are basically like the hotels for your white blood cells. Your white blood cells kind of go out to your police force, right? So they got to go out. If you got an invader coming in, they got to go out and hunt it down and kill it. Well, the white blood cells could get tired from time to time. So the lymph nodes are basically hotels for the white blood cells that kind of rest in. Okay? To go a little bit deeper into this, just another picture. You can see you got the artery, you got your cells, you got the vein, and then the green stuff is the lymph. So we have fluid that is in our body, is basically in two different areas. We got fluid and water inside our cells, and then we have fluid that is outside our cells, or the extracellular matrix, or the interstitial fluid. So that's just a good picture of that, of how blood and oxygen and nutrients come in, it diffuses across out of the capillaries so that the cells can get their food, but it also has to take away their waste. And it goes into the venous system, and then the waste kind of gets drained into the lymphatic system. Just another picture of that is this, just to kind of give you guys examples of visuals. Now, the immune system, it has an intelligence. It has to learn and it has to adapt. Thing about newborns, right? What do you notice about newborn kids? Their immune system is very, very weak because they get sick very frequently, right? Well, what's one of the things that they do all the time? put things in their mouth. Why are they putting things in their mouth? To inoculate themselves, right? It has to, in order to get stronger, you have to be exposed to things, okay? So the immune system needs to be challenged in order for it to learn and adapt. But it cannot be overstimulated. You can definitely overstimulate the immune system and upregulate it, and this is where it loses its ability to identify self and non-self tissue, where autoimmunity comes into play. So you got to challenge it. And who knows better than Rocky, right? He got challenged. But when you're done with this workshop, you'll be able to knock your germs out in one punch. Okay. So where is your immune system located? You guys are smart. Yes, absolutely. It's everywhere, right? It's just like a castle. The whole thing is designed for maximum defense. So your immune system is everywhere. Now we have two different types of immunity. We have innate immunity, or your resistance to the non-specific, which are your physical barriers, your skin, the mucous membranes in your lungs, in your sinuses, in your gut, okay? So the physical barrier itself. And then we have the specific or the acquired immunity, which is once you're exposed to a certain pathogen, this is where the immune memory comes into play. So they kind of sit on this teeter-totter, and they have to work in tandem. So the innate immunity gets hit first and launches its war, and then once it has enough, then it hands it over to the acquired immunity, and that takes over. And this is where the cytokine storm kind of comes into play, because it sits on a teeter-totter, and we'll get there in a second. So we have the immune system, where you have immunostasis, where you have a properly functioning immune system, right? Homeostasis is balanced, your autonomic nervous system is balanced, and the immune system is balanced, where you have normal function. Now, your autonomic nervous system is that sympathetic and parasympathetic nervous system, right? The fight or flight, the rest and digest. That also sits on a teeter-totter. But you can become sympathetically dominant due to stress, eating habits, right? Not getting adjusted, things like that can kind of stimulate that, which will then ultimately weaken your immune system, as we'll see later that the research shows. So you have immunostasis, where you have the innate and the acquired that sit together. However, there are certain things that can happen that can cause an imbalance, and you can get locked in one way or the other. And this is where you have immune dysfunction, where you've got a disruption in homeostasis, the autonomic nervous system, and an unbalanced immune system. And when this happens, what do you experience? Hypersensitivities. And what do you get from that? Seasonal allergies, food sensitivities, hives, rash, asthma, and autoimmunity. Now, there is one thing that controls this, and this are your T regulatory cells. Okay? So you have T regulatory cells that balance and work on managing this so that it remains balanced. Now, during COVID, what did some of the research that came out of that, what did they find? People that went to the hospital that had respiratory issues, that got on ventilators, what were they low in? Vitamin D. So again, during the winter months, how many of you actually take vitamin D supplements, right? So that's one thing that you can do, because if you are vitamin D deficient and you launch the innate immunity and it gets stuck there, you have this cytokine storm and it causes destruction. This is where all the fluid and stuff came in the lungs during COVID. So vitamin D is just one thing that you can do that will help to support the T regulatory cells. What else can you do? Vitamin A. How many people are deficient in vitamin A? Vitamin A helps your body make antibodies. It also helps the epithelial cells inside the lungs, inside the mucous membrane, inside the gut to heal and repair. Okay, so vitamin A is really, really important. Vitamin D3, omega fatty acids, which can help with inflammation in the body. I have all three of these in this Ultra D5000 product. Okay, another thing that helps to support T regulatory cells is nitric balance. The last thing that I have is trisomal glutathione. Now, glutathione is the most powerful antioxidant and detoxifier in the entire body. It is great for your liver, it is great for your immune system, it is great for your gut, and it is great for cellular health. Okay? So if you get sick at all or want to prevent this, I have these products that can kind of help to support your T regulatory cells so that your immune system can stay balanced and strong. Now, there's a couple of different mechanisms of how immune cells actually attack and destroy bacteria, viruses, damaged tissue. Okay? I'm going to show you a visual because I think it's pretty cool, just so you guys kind of get an idea. There's this process called phagocytosis, okay, where you have a neutrophil. Now, a neutrophil comes and it engulfs this bacteria. Now, these little orange circles in there, little bags, they're called lysosomes. And what is a lysosome? It's basically a bag of enzymes. And what do enzymes do? They digest. So when it swallows the bacteria, the lysosome comes over, dumps all of its enzymes in there, digests it, and then the neutrophil spits all of that back out into the environment. Isn't that pretty cool? I actually have an animation of this that we're going to show you how this works. Here comes your little bacteria or a foreign object. And as it comes, see all these little chemical reactors, chemical messengers? It gets released and it tells the white blood cells, hey, there's something that's not supposed to be here is here, come get me. This is your blood vessel. You see how it separates and the neutrophil leaks through your circulatory system. Then it comes and it engulfs it. It digests it, and then it spits it back out. Isn't that cool?
Different in my high school, yeah.
Yeah, right? All right. So what is responsible for keeping all these germs in check? Well, homeostasis, obviously, right? The autonomic nervous system, sympathetic and parasympathetic, and the immune system. So if these three are out of balance, then yes, you're going to get sick. But is it possible to get exposed to a virus, to be infected with the virus, and not be symptomatic from it? Yes, absolutely. So what monitors, regulates, directs, and controls homeostasis, the autonomics, and the immune system? Anyone take a guess? Yes, the brain, exactly, the nervous system. You guys are a smart crowd.
I should give it away.
Well, you know, this is an open book. All right, so your immune system is directed by your nervous system. This study said that the central nervous system also exerts a modulating influence upon the immune response. This may take place both by secretion of hormones and by nervous neurotransmitter influence upon the immune system. Nerve dysfunction is stressful to the visceral nerve and other structures and lowers tissue resistance, modifies the immune response, and lessens the overall capability of the immune system. Nerve dysfunction, what could they be talking about? Subluxation, yes, exactly. When the sympathetic nervous system increases, The activity of the immune system decreases with the resultant increased susceptibility to infection. So an increase in sympathetic tone. So B.J. Palmer basically said it best, is that the power that made the body heals the body. It happens no other way. He is kind of the developer of chiropractic, and he basically said that if the germ theory of disease were correct, there'd be nobody living to believe it. Right? People have more faith in a spoonful of medicine than the power that animates the living world. And how true is that? People just don't have trust in their bodies anymore. You know, it's like you have this immune system, you have this innate intelligence inside of you that your body is designed to thrive and to heal. But what happens is that we abuse our bodies mechanically, emotionally, nutritionally to a point where it can't come back from it. Okay, so it's an ounce of prevention is worth a pound of cure. That's why developing habits when you're early is really, really important. Studies have measured the effects of chiropractic adjustments on the immune system, have shown that chiropractic may influence T and B lymphocytes, natural killer cell numbers, antibody levels, phagocytic activity, and plasma beta endorphin levels. Clarence Gonstead was a giant in the chiropractic community, and he had his own set of techniques and the way to adjust people. The best immune system is in the body. It's not in the lab. And I wholeheartedly agree. And he kind of goes through this little flow chart of how people actually get sick, right? So if health equals brain-body communication and autonomic nervous system balance, then stress, poor diet, sedentary, being sleep deprived, and not getting adjusted, it causes subluxations. Now, subluxation interferes with brain-body communication and imbalances the autonomic nervous system. Subluxations cause an increase in sympathetic tone. Increase in sympathetic tone decreases or inhibits immune action and increases susceptibility for infections.
Can you say more about sympathetic tone?
Sure. So the sympathetic nervous system, right, it sits on a teeter-totter. So the sympathetic nervous system is the fight or flight response. The parasympathetic is the rest, digest, recuperate, and reproduce mode, and the heal mode. So if you get locked and become sympathetically dominant, you do not have the ability to rest. You do not have the ability to heal. You do not have the ability to digest your food or to reproduce, because the sympathetic tone is high and it's sustained. Okay? Good question. Getting adjusted regularly decreases subluxations, restores brain-body communication, and balances out the autonomic nervous system. This restoration of normal function naturally allows the immune system to do its job more effectively. The one thing that a chiropractic adjustment does is that if you are sympathetically dominant, it automatically balances it out after the adjustment. Now, does your lifestyle, does your stress, does your diet, does your mental health and what's going on in your brain, does that bring the sympathetic dominance back? Right? So again, this is where diet and lifestyle kind of comes into play. But the adjustment automatically balances it out. Bottom line is that when you get sick, first thought that should come to your mind is you need to come in and get adjusted. That's the best thing for you, is to get adjusted while you're sick. So how do we get sick? Well, you inhale or you ingest something. The foreign invader gets into our body and it starts to multiply. The innate immunity starts its flight and white blood cells start to multiply. It launches the attack on the foreign invader. Homeostasis gets disrupted. You get lymphatic congestion. And when that happens, then you start to experience symptoms. What are the symptoms? Fever, sore throat, cough, sinus congestion, right? Aching, body achiness. So what is the purpose of a fever? You guys know?
Environment that's not
Very, very close. Yes, almost 100%. It's to raise the core body temperature so that bacteria or virus slows down its replicating. So it helps to decrease the replication of that. The second thing that it does is it helps to stimulate the body to produce more white blood cells. So there's two purposes to a fever. So sore throat, right? Cough. Once things kind of get into our system, you got the replication of the virus, got the replication of the bacteria, you got the replication of white blood cells. So what happens in your bloodstream? You get all this mass production of stuff that then makes the internal environment kind of junky, right? And that's where that lymphatic congestion comes into play. When the lymphatic system gets congested, it's going to stress the liver, the spleen, and the kidneys. Where's the overflow valve for that? Sinuses. This is where the sinus congestion comes into play. Then it stresses the lungs. What are the lungs? The lungs are an organ of elimination to get toxins out of the body. So if you get that infection and your body can't clean that out, that's where you get either the dry cough or the productive cough. Okay? So you see how there's things that kind of happen in a systematic way when we get sick. Now, how do you know if you have lymphatic congestion? Great question. Well, I'm going to tell you, and you can do this on yourself. Take your finger pads of 3 fingers right behind your clavicle, and between your clavicle and the upper trap, firmly press in there. Is that sore or tight in there? Do you feel that? If that's tender, that means you've got lymphatic congestion, and it's on both sides. Okay? It should not be tight, and it should not be tender at all.
Is that above or below your?
Above. So between the clavicle and the upper trap. Right in through there. Okay? There's 2 places. Another spot is find your elbow and come up north to that and right in through there. You rub that firmly. This is for upper extremity on both sides. Okay? If that's tender, you've got lymphatic congestion. In the lower extremity, it's right below the knee on the inside. You rub right in through there. In the soft part, off the tibia. Okay?
And why would it be maybe more sore on one side? Is there a reason for that?
Great question. Why it's sore more on one side than the other, or upper or lower? It's just where the congestion is. Okay, so it depends on, because your lymphatic system doesn't have a pump. So how do you move your lymph? This is where water comes in. How much water do you drink? Exercise, movement helps to move the lymphatic system. I've given many of you that breathing exercise with the head and the feet, the abdominal breathing. Guess what the name of that exercise is called? A lymphatic pump. So you can simply do abdominal breathing to move the lymph in your system. Isn't that cool? All right. Any other questions? Okay. So then after a while, then the innate immunity hands it off to the acquired immunity to finish the job, and this is where memory gets developed. And then homeostasis returns to being balanced, and the symptoms go away. So when you get infected with something, the innate immunity kicks off, does its job, and then the T regulatory cells are supposed to be able to balance that out and hand it off to the acquired immunity. Okay? But if the T regulatory cells are deficient, you're vitamin D deficient or vitamin A deficient or glutathione deficient, right? Then it can't do that, and it gets stuck one way or the other. This is where the cytokine storm comes into play, and where your symptoms can actually be really, really bad. And it'll just take you longer to get over that infection. During COVID, I probably had about 50 patients or so that ended up getting infected with COVID. I did not wear a mask at all. I was not scared of this thing at all. I only wore a mask when people that wanted me to wear a mask because it made them feel comfortable, I did that. But during the whole COVID thing, most of my patients had mild symptoms for like 5 or 6 days, and then it was fine. It's like a mild case of the flu that they got. A handful of my patients that don't get adjusted regularly, eat like crap, they don't exercise, and they have high stress, had symptoms really, really bad. And it took them about 6 weeks to get over it, at least, okay? Because when your body is deficient and out of balance, it's existing in a weakened state. So you get infected with something, it's just going to throw a wrench in the whole system, and it's going to take longer for things to happen. So what negatively influences your immunity? Well, stress, right? Your diet, consuming lots of genetically modified foods, processed food, ultra-processed foods, fried foods with a lot of seed oils, canola oil, vegetable oil. Throw those things out. That causes nothing but inflammation in the body when you consume that. Sugar substitutes.
What's a good oil?
Coconut oil, extra virgin olive oil, avocado oil. Make sure they're organic. Poor digestion. Where is 70% of your immune system located? In your gut, right? So if you've got digestion issues, chances are you've got a weakened immune system. Reminds me of a patient. I had a patient comes in that had neck pain and a wrist pain. He like went over the handlebars on his bike and he injured his wrist. So I started working with him and he said, I've had IBS for 20 years. I'm like, okay, well, do you want to take care of that as well, or you just want to focus on the wrist? Like, just focus on the wrist. Like, okay. David, I got a question for you. Do you chew your food? Like, what? Like, do you chew your food? He's like, no, I inhale it. He's like the first one done. I'm like, do you think that's part of your IBS? So it was really, really hard for him to slow down and chew his food. But he got there, and now he's the last one that's finishing at the table. But never focused on the whole IBS thing. He had 2 little girls, 8 and 10, and every time they brought something home from school, he would get it and would be sick for 6 weeks. Every single time. Like, wonder if that has anything to do with your IBS. So he ended up getting pneumonia or something and ended up in the hospital. And the doctors gave him antibiotics. He had an adverse reaction to the antibiotics. So the doctor discontinued it, but the nurses gave it to him 2 more times. He almost died in the hospital. He came out and he's like, all right, let's fix my gut. So, it's like, so he did this whole gut repair thing and cleansing and stuff like that and made his gut stronger. And now when his girls brought something home from school, he had mild symptoms for 2 days. So from going from 6 weeks to 2 days and having mild symptoms, like the proof is in the pudding. So what else negatively influences the gut or your immunity? Not sleeping, right? You show me somebody that's not sleeping, they're not going to heal. Not getting chiropractic care, right? Having subluxations. So what positively influences your immunity? Managing your stress better, right? As adults, we take on all these responsibilities of everything that we got to do with family and work and spouse and all that stuff that we forget to have fun. So give yourself that permission to actually play and do something that brings you joy. Do you think that will help with your overall disposition in your immune system? Yeah, absolutely. Diet, eating a variety of fruits and vegetables. Your omega-3s, right? Chia seeds, flax seeds, hemp seeds, salmon, right? Sardines. Make sure you're drinking plenty of water every single day to flush out that the lymphatic system. Support your digestion system, right? By simply chewing your food. How many of you guys are sick of me telling you about this? Right? Chew your food. taking digestive enzymes if you need to help support that. Supplementation, enzymes, Juice Plus, vitamin D, glutathione. Sleeping, getting regular exercise, and getting chiropractic adjustments. Now, I think I've talked to a lot of you guys about Juice Plus. I'll just go over this really quickly. But Juice Plus is basically 30 different fruits, vegetables, and berries in concentrated forms in capsules for adults, and it comes in chewables for kids. They also have an omega blend, which is the orange one, that has an essential fatty acid blend. The reason I like this so much is because they have published over 48 different studies in peer-reviewed journals. And what that research actually shows is this. Everything that's on here has been backed up by science and research. Once you take the Juice Plus capsules, does it actually get into your system? There's so many times when people take capsules and stuff like that it can actually pass through and they'll see it in the toilet. Okay? You'll actually see it on an x-ray too. I've seen x-rays where people have capsules and things in their gut that it's not diffused and not bioavailable. It supports immune function. It decreases biomarkers of inflammation, provides antioxidant protection, DNA protection from oxidation, reduces exercise-induced oxidation. Oxidation is a 50-cent word that means rusting. So when something oxidizes, it creates free radicals and it can be a bad thing. So if you got a fire that's brewing and the smoke that's coming from that fire, you want to be able to quench that smoke so it doesn't cause damage. That's what this protection from DNA and reduced exercise-induced oxidation means. It increases the omega-3 index. You've got omega-3 to omega-6 fatty acids. Most people, when they consume a lot of processed foods, baked goods and stuff, their omega-6s are extremely high. The omega-3s are very low. When this index is off, your body is very inflamed. So when it increases that omega-3 index, it's because you're taking more of the omega-3s and trying to minimize the amount of omega-6s you're taking in your diet. Lung function, dental health, skin health, cardiovascular health, metabolic health, gut health, and improves cognitive processes. All by taking 8 capsules a day. So Juice Plus is kind of my go-to for basic nutrition for the entire body, because what do you think would happen to your system if you gave 30 different fruits, vegetables, berries, and omegas to your system every single day? Would that be a good thing? Right? No. So that's kind of why I love this. So this is more generalized nutrition that impacts multiple systems in the body. I have enzymes for more specific needs, okay? So I have an immune protocol, vascular, spleen, and trauma to kind of help. What are these? They're enzymes, right? The trauma especially. Trauma, when you dump trauma into the body, you're just like basically dumping 10,000 workers into your body for your immune system to have more police force. So it's going to get more stuff done. It's going to attack it faster. The spleen, it helps to oxygenate the body, but there's also herbs in there that helps to stimulate the bone marrow to produce more white and red blood cells. So being able to produce more white and red blood cells while you're sick is just going to get that more of that police force out there faster. If you've got specific organs that need to be supported, like your sinuses, the lungs, the kidney, or the liver, I've got enzymes to support those. If you need something a little bit stronger, like an antibiotic, this is where RE3 comes into play because there's lots of garlic that's in there. There's also garlic in the nasal, which helps to support the sinuses. So if you get sinus congestion, nasal is your guy. If you got lung congestion and mucus in the lungs, RE3 is your guy. And then you've got stronger products, the GV14, and then, oh look, FARSP. Dr. Loomis actually made a product called FARSP, which is his strongest enzyme formula. And this is to help lymphatic and immune support. And then you got vitamin A, D, glutathione, and omega-3s that are all kind of responsible for that. They help support that. So what do you think would happen to your immunity if you got regular chiropractic adjustment? This is the bare minimum. Just get adjusted, right? If you're able to master your stress, eat a cleaner diet, exercise regularly, get adequate sleep, take your Juice Plus daily and your enzymes as needed. Oops, wrong button. Right? Garbage in, garbage out. Health needs to be built daily. So what are you doing to build your health? All right, couple testimonials and then we'll be on our way. All right, so Hope. Hope has been a patient of mine for a while, and she calls me up and she's like, you know, I've got this sinus congestion. I can't breathe out of my nose. I've been blowing green out my nose for the last 3 days. I don't want to go to the doctor and get antibiotics. What should I do? Come in and get adjusted. So she comes in, I adjust her, I work on her, I rub out her lymphatic points in her legs, and she leaves. Don't give her anything, just work on her body physically. She texts me an hour later, she's like, what did you do? It's like,
You did voodoo.
yeah, voodoo, right? Exactly. She's like, my nose is clear, the green is gone, and I can breathe fine, right? So it's amazing what happens when you actually give the body its support that it needs. Paula. So one of the things I want to talk about, a lot of people say that they get sick during the holidays. Well, do they actually get sick because they get infected with a bug? Or is it the fact that they're so stressed out about preparing everything, getting the right gifts, hosting, making sure everything is perfect, then once the holiday's over, they are actually able to relax, and then they have this emotional detox, right? Or is that really what's going on? So sometimes being sick is not always due to a bug or a virus. It can just simply be from emotions. And Paula has an interesting story. So she comes in every 2 weeks to get adjusted. She usually comes in on Tuesday. And she calls me up Friday after she gets adjusted on Tuesday. She's like, I still feel off, I just need to come in. So she comes in Friday, get another adjustment. She goes home that night and she eats dinner and she ends up throwing it up. I'm like, oh, okay. Saturday comes, she develops a cough. She goes to urgent care. They diagnose her with bronchitis. They send her home with an inhaler. She starts to get stomach pain as well as a cough. She has no appetite whatsoever. And Sunday comes, no change. Monday comes, no change. Tuesday she calls and comes in and she's like, I just feel terrible. Can I come in and get adjusted? Like, yes, absolutely. So she says, I'm nauseated. My stomach hurts. I have no appetite. I just feel terrible. I'm like, okay, well, let's run around the horn. Mechanical, emotional, nutritional. Let's see where it's at. So mechanically, did you injure yourself? Did you trip and fall? Did you lift something heavy? No. Nutritionally, did you change your diet at all? Have you eaten something bad? She's like, no, I've barely eaten at all in the last 3 or 4 days because I just have no appetite. Now what's left? Emotional. So what's going on emotionally? Nothing out of the norm that I can think of. Like, I don't really think of anything. I'm like, okay. So I lay her on a table and things that she said, she is nauseated and has stomach pain. So I'm like, okay, I know nausea is due to lymphatic congestion and kidney stress. So we have 3 filters in the body, right? Liver, spleen, kidneys. So I put her on the table. I don't adjust her, don't do anything, just assessing. I hit her liver stress point, that's fine. I hit her kidney stress point, that's fine. I barely touch her spleen and she's like, jump. She's like, whoa. Like, hey, we found something. So I go through and I adjust her and, check it when we're done. It's still tender. So I start to rub out her stress points on her legs and stuff like that. And I'm like, so something has to be going on emotional, Paula. What's going on? She sat there and she thought about it. Then she's like, oh. She's like, last week, my mother-in-law, who is 93, went into the hospital. and she was worried and concerned that she wasn't going to come out. And she kind of stuffed this down into her subconscious. So she just shed a tear, right? Single tear, and got done rubbing her legs, went to hit this, completely gone. She sits up from the table. She's like, wow, my stomach pain is gone. She stands up because her brain's trying to register everything that just happened. And she's like, wow, my stomach pain's gone. I'm hungry. Wait, no, I'm starving. Like, I need food like now, you know? So in a matter of like a second and a half, you can see her brain processing this, and she's like, wow, because she had this subconscious emotional stress that she brought consciously, made aware of it, released it, and her brain was like, thank you. I can go back to normal now. So I thought that was pretty cool. And then Judy comes in every 2 weeks. She have her on an enzyme program that she does. She eats pretty well. She exercises. She comes in. She says she's got a sore throat. So I'm like, all right, well, I know she's nutritionally sound because we've gone over her diet. She takes her supplements. She gets adjusted regularly. And I'm like, all right, her throat. So what is your throat emotionally? It's your voice. So I say to her, so who are you supposed to be saying something to that you're not? Without hesitation, she's like, my boss. So I'm like, all right, this is what I want you to do. I want you to go home, and I want you to visualize your boss standing there right in front of you. And I want you to speak out loud and give voice to everything that you need to say to them. And do not edit yourself. So she does that, sore throat, gone. So it's like there's some things that happen that's not just by a bug or a bacteria, but it can be emotionally related as well. So I hope this was enlightening for you guys. Now the rest is up to you to take this knowledge and go out and be on your merry way with stronger immunities.
Oh, thanks, Dr. Keith.
Questions? Comments? Concerns? Yes?
So for those struggling with the emotional part, would you recommend like emotional therapy as a way to help with that in addition to chiropractic?
Yeah, so I do a emotional breathing release technique that I do that actually helps to release that emotion. Sometimes I feel like I'm a therapist more to my patients than anything. So there's some work that you can do at home as well, such as like journaling, meditating, learning how to let things go. I did a lecture on anxiety, depression, and gut health, where I go over a lot of that mental process in the second half of my lecture and things that you can do to kind of help let that go. So it's just kind of understanding, becoming a student of you, understanding what triggers you and what you can do to manage it better. So there are certain things and pitfalls that we get into our mindset that causes us stress. So if you're aware of this and there's certain things that stress you out all the time, it's learning how to be in that environment and switch your perspective so that that stress doesn't affect you as much. So, good question. Yes.
On the slide that you had the teeter-totter,
Yes.
and you were showing the imbalances, and on the right-hand side, you had listed like more chronic conditions, like I remember asthma was one, autoimmunity.
Yes. Seasonal allergies, food sensitivities,
Right.
hives.
So if you're in that position and you're doing what you think are the right things, and you're still stuck, like, is there a way to get back from that? Like, can you
You're talking about
ever get rid of asthma? I don't know.
Asthma? Yes, you can. Yeah. If you're talking specifically about an autoimmune issue, that can be a little bit more trickier depending on how long you've had it. Because when you're talking about autoimmunity, you're talking about there's 3 different phases of it. There's autoimmune silent, where it's the fire's starting to brew, but you're not symptomatic yet. Then you're autoimmune symptomatic, which now you know you have it. And then there's autoimmune destructive. And once you get to that point, the immune system is really gone. But what you can do is kind of help to manage the symptoms the best that you can from a natural perspective. Asthma, yes, you can absolutely get rid of asthma. I had this guy come in who was 56, and he's been to many chiropractors his whole life. And he comes in and, typical neck pain, low back pain. He has this upper back tightness that he's had his whole life. Well, he's had asthma his whole life and has an inhaler, a rescue inhaler, when he needs it. And sometimes when he exercises, he needs it. So I'm like, well, where do you think the nerves come from your spine that actually innervate your lungs? And she's like, the upper back. It's like, so if your lungs are weak and you've got muscle contraction in the upper thoracic spine, if we actually gave the nutrition for the lungs to do their job, do you think that this will loosen it up? So I gave him some enzymes to help support his lungs, clean up his lymphatic system. And after a month, 6 weeks, that chronic tightness he's had his whole life was gone. So I had another guy, 23-year-old guy, come in that has had asthma his whole life, has had an inhaler. He needs to use it every day. He's had a chronic sinus issue since he was 8 years old. He's 23 now, and he gets adjusted once a month from a chiropractor since he was 8. Because when he was 8 years old, he was in a car accident. He was in the back seat, and his head actually hit the window. So he's been getting adjusted once a month for his whole life, or since he was that accident, that only helped to alleviate the sinus stuff temporarily. But when he came to me, he was like, I literally takes me like 10 to 15 minutes to blow out all of the mucus in my nose every single morning. So I'm like, geez, okay. So he comes to me, I find this huge knot in his neck, a huge knot in his back, and muscle contraction in his calf. So I adjust him, I stretch his calf, and I do some myofascial work on his calf. First adjustment, and he gets up off the table, and I'm like, all right, now, the best thing you've got going for you is that you're 23. So don't be surprised tomorrow if you get up and your sinuses are significantly better, if not gone. He looked at me like I had 8 heads. He's like, what are you talking about? So he comes back in the next day for his next adjustment with this big old grin on his face. Like, you know what? You were right. It wasn't gone, but it was a lot better. And unbeknownst to me, he stopped using his inhaler after his first adjustment with me. That he did not tell me that until like a month later. And he's tried to go off his inhaler before, and he could only make it 4 or 5 days before he felt like he needed it. So what was his problem with his lungs and his sinuses? Well, when you've got subluxations at the base of your skull and the pelvis, and your spine is torqued, and you've got that contraction in your calf that's pulling on everything, do you not think it's going to increase the sympathetic tone in the nervous system? When the sympathetic tone is increased, it affects all of the organs, not just the lungs, but his gut, the sinuses, like everything. So when you release that, when you correct the pelvis and release that tension, and you bring that sympathetic tone down, what happens? Parasympathetic was what? Rest, digest, recuperate, heal, and reproduce mode. But when you're sympathetically dominant, you can't heal. So yes, you can get rid of asthma. Anything else? Okay, thank you guys. Thank you so much for watching my video. Now I would like to hear 2 things from you. Number 1, what is one thing that you learned from watching this video that maybe you were not aware of before viewing this? And then number 2, what do you do? What habits that you have that's specifically there to strengthen and build your immunity? Let me know in the comments below. I greatly appreciate that. Also, make sure to hit the notification bell and subscribe to my channel so that you get notifications for future content that I publish. And then lastly, if you've benefited from this content in any way, shape, or form, and you know somebody that could also benefit, please share this information with them. We need more people out there that are healthy and strong, because let's face it, there's a lot of sickness that's out there. So I'm Dr. Keith, and remember that it's your health, it's your body, it's your choice. Own it.